Hello and welcome to the Better Health program sponsored by the City of Albuquerque Human Resources Department. My name is Lisa McNichol-Gaton and I'm the Health and Wellness Coordinator of the Better Health Employee Wellness Program out of the Insurance and Benefits Division. And the mission of our Better Health program is to help our employees improve nutrition, increase physical activity, and reduce tobacco use. By doing so, we believe we can reduce the number of chronic health conditions that our employees experience. We're also very interested in helping our employees detect any chronic disease risk factors as early as possible, and we provide on-site health screenings at various locations and various types of health screenings for our employees and their families. Now today our show will talk about the importance of regular mammography as well as colorectal cancer screening. And we're going to focus on 4 key areas today for both of the topics. We will be talking about the key statistics around mammography and colorectal cancer screening. We'll also discuss the benefits of screening. We'll talk about the screening rates in New Mexico. And finally, we will go over the American Cancer Society's screening recommendations for both mammography as well as colorectal cancer. Now with me today is Doreen Conley, and Doreen is the Health Systems Manager with the American Cancer Society Great West Division. And she has been in this role for over a year. And prior to this, she was a health educator with the New Mexico Department of Health Breast and Cervical Cancer Program, as well as the Tobacco Use Prevention and Control Program. And she worked with the Department of Health for 8 years. So welcome, Doreen, and thank you so much for being here today.
Thank you, Lisa.
Well, we're going to start our discussion by talking about the importance of regular mammograms, and then we'll get into the colorectal cancer screening. So let's start with some of the key statistics in New Mexico, and in particular the current rate of incidence and mortality of breast cancer.
Thank you, Lisa, for that question. It's a very important question about breast cancer. So incidence refers to the number of new cases of a disease that are diagnosed each year. And incidence rates for breast cancer, for female breast cancer cases in New Mexico, average just over 1,200 cases a year. The exact number is 1,209, and that's a yearly rate of new cases of female breast cancer diagnosed in New Mexico. Mortality rates refer to death rates. And on an average, approximately 240 women die of breast cancer in New Mexico each year. Those numbers may not seem large, and yet when we think of 240 women in New Mexico losing their life to breast cancer, that really is a burden in our state. For the most part, though, 85% of cancers diagnosed in New Mexico are in an older population of individuals over 50. So cancer is a disease for aging individuals. As we get older, our risk increases. But that's why mammography is so important to reduce that rate.
Okay, well let's talk about then the mammography screening rates in New Mexico. How well are we doing in getting screened?
We're doing well in New Mexico. Our rates are very close to the national average, which is hopeful. That's a good sign. In New Mexico, approximately 71% of women who are aged 40 years and older report that they have had a mammogram in the past 2 years. So that's good. Just about 7 out of 10 women are getting their screenings. There are some differences in screening rates in New Mexico. Some women of different ethnicities, some ethnicities and races are not being screened as often. There may be cultural considerations to not get screened, but there are some barriers that we try to overcome. And then certainly for women who are uninsured and don't have access to services, their rates for screening are much lower. So that 70% is an average. and we hope to get all women to that rate. And that's why we work so hard on mammography.
And today with our program, hopefully the education that we can provide might encourage some of those that might be experiencing some of those barriers, and to actually seek the mammograms and to talk to a healthcare provider. So we'll provide some resources later on in the show. Let's go ahead and talk about the benefits of mammograms.
Mm-hmm. Well, as I said, as a woman ages, her chances of getting breast cancer increase. And so we need to be vigilant as we age, as women, to be checking for breast cancer. Mammography is important because breast cancer starts very early in the breast, and it may not be detectable by touch. And so as cancer grows, it becomes more and more detectable. But it's very important for women to get the mammograms because mammograms can detect those smaller changes in a breast and find that cancer earlier. If breast cancer is found earlier, it means that women have more options, and that's really good.
Yes.
There's a better chance that a woman can save her breasts. So I did not have that option. And it's very devastating for a woman to lose an entire breast. We have procedures now to just remove the cancer. And a woman may not need to lose her breast, but it means we need to find it early. Early detection also means that a woman may not need to do as much treatment as far as chemo and radiation. And so knowing just what a woman needs to do can be helpful because more treatment can mean more side effects that will affect a woman later in life. So mammograms are really life-saving in a lot of ways.
Very important. Well, we have a nice visual aid that was developed by Health Ed Co. to help educate about the benefits of mammography. And in this particular visual aid, they demonstrate how small of a mass that a mammogram can detect in a woman that's had regular screening. So they use the size of a seed. That's how small it can detect. They go on with the seed analogy to the size of a cranberry. The mammography can detect a mass this size. You know, if something is detected at any of these sizes, it does warrant further study. But to the touch, clinician can also, I think they can find something as small as a frozen pea, I've heard before, but the grape represents something that can be found by the touch, the size of a cherry as well, and then when the mass is really large, you know, it can be found as large as a strawberry, and that is a larger mass of greater concern, of course. So, anything you wanted to add about this particular visual aid?
Well, Lisa, I'll talk a little bit, in just a little bit about my personal experience, but this is a wonderful graphic for women to see. And I would like to share that when I found my cancer, I am a cancer survivor, a breast cancer survivor, I felt my lump about here. I wish I had found it here on mammography, but I was young, I was 40, had not had a mammogram yet. I found it here, and within just a few months, my cancer, which was a type of rare aggressive breast cancer, it's a little different, not normal, but within just a few months, I was at that phase. And I'm sure that my cancer at some point was at that stage. And if I'd had a mammogram, I might have saved my breasts as well, and a lot of treatment. So this is very helpful for women to see how beneficial it is for a doctor to find a mass at that size versus that size. So thank you for showing this. It's very important to know.
Well, this leads, I think, right into then what are the American Cancer Society's screening guidelines?
The American Cancer Society guidelines, I want to say, are available online at cancer.org. There's a lot of information. I'm going to share just the basic guidelines that we have, but women can go to our website for more information. but we recommend that if a woman is 40 or older, she should have a mammogram every year. She should talk to her doctor about having a breast exam by the doctor or the nurse. It's called a clinical breast exam. Having one of those once a year. It's important for women to know their breasts as well, but a clinician knows what to look for and knows what to feel for. So that clinical breast exam every year, in addition to the mammogram, is very important. A woman at any age, certainly the American Cancer Society recommends this at age 40, but really at any age, a woman should talk to her doctor about any changes that are occurring to her breast. Changes could be finding a lump, as I did. Cancer in the breast does not always show as a lump. And so looking for other changes, such as a sore that does not heal, or an area of thickening in the skin that feels thicker, that's changed. Some of my symptoms were not what women would normally think of, but they're important, such as redness and swelling. I had that, and I had some dimpling in the breast. What I didn't know was my tumor was so large, it was starting to pull some of that skin into it. So I had dimpling like an orange peel. That is something to talk to a doctor about. And then certainly, you know, we don't always think of changes in the nipple as being important. That is important as well. Any scaliness on the skin or any discharge that's not normal. Any of these things are a reason to speak with your doctor as soon as possible and not wait. The American Cancer Society also recommends having yearly mammograms throughout our life, regardless of age, as long as we don't have any other serious health problems. So many women are wondering, when can I stop having mammograms? It's a conversation with your doctor every year to see what is best and right for that woman to protect her in her lifetime.
Well, I really appreciate that, you know, having that discussion with your provider. I mean, there are other bodies that have different recommendations for breast cancer screening, so having that conversation is so important and based on an individual's need. So I'm glad we're discussing that. Now, you mentioned that you are a breast cancer survivor and you are willing to share your experience to help women. And you've already mentioned some things, but what key message do you like to tell women based on your experience?
Well, talking to your doctor. So there are a lot of recommendations. There's guidelines. That's what they are. They're guidelines for providers when serving their patients. For women, it's important to have a conversation with your doctor yearly, beginning, I think, at a younger age. There are other considerations that may change when a woman needs to begin having mammograms, such as a strong family history or a history of benign breast disease. So a woman really needs to make the best decision for her with her doctor. So certainly that conversation, an ongoing conversation. I want women talking about breast cancer so that, you know, getting educated really empowers us. I hear a lot of women say that mammograms are painful, you know, and they can be uncomfortable for a short period of time. But when I got breast cancer, I had a lot of pain for many, many, many months. And that short, uncomfortable mammogram procedure would have been much better than all of that treatment that I had to go through. But two other very important messages. Finding cancer early is critical. My first cancer was nearly stage 4, and it took a year of treatment and a year of recovery, and I lost so much through the process. I was lucky to have my life at the end. My second cancer, so I'm a 2-time survivor, I was diligent and I found it early. And I had 2 weeks, a little surgery, and then I was done. And so finding it's early. For women who don't have access to health care or mammograms, there's still uninsured women in our state. There are free resources. New Mexico is a wonderful state for having those resources available to those who need them. Anyone can call the American Cancer Society number that we'll share at the end of the show at any time and find out locally where they can access free mammograms and get that care they need to prevent this disease.
Oh, sounds great.
So thank you.
Well, so the city of Albuquerque, as well as other employers, pay for a large portion of employees and family members' medical premium. And so it makes good sense as a strategy for us as an employer to encourage our employees to be within the recommended guidelines for all of our health screenings. And this is one way that we think we're going to control healthcare costs, and we're going to increase productivity and reduce absenteeism. In fact, we had a goal for the past 12-month operating cycle of reaching at least 175 women in our on-site mammography van that was coordinated with our health plan. And we superseded that goal, I'm happy to say, with 206 mammograms.
Oh, that's wonderful.
So we're very happy about that, and we've done some other work too now on our next topic about the colorectal cancer screening. So let's go ahead and switch gears and
Sure.
talk about colorectal cancer. And would you tell us what is colorectal cancer and what are some of the key statistics, in particular the current rate of incidence again and the mortality of colorectal cancer?
Sure. Colorectal cancer is another cancer we can screen for, like breast cancer. Not a lot of people talk about colorectal cancer, so thank you for addressing this topic today.
True.
Very important. I hope we share some good information. Colorectal cancer is cancer of the colon or the rectum. The colon is part of our intestine. The colon and rectum together work together to process the food that we eat and digest it. And then they hold on to the waste till it's ready to be expelled from the body. Colorectal cancer in New Mexico, the incidence rate for colorectal cancer, which again is the number of new cases each year, is right around 820 cases. That's an average per year. This is men and women now. So colorectal cancer affects both men and women, as does breast cancer. Not many men get breast cancer. With colorectal cancer, men and women share the burden of the incidence. And we see approximately 317 deaths per year. So 820 new cases, 317 deaths per year on average in New Mexico, men and women. But those deaths are completely preventable. So in breast cancer, we said, oh, those 240 women, we don't want to lose that many women every year. In colorectal cancer, we don't have to lose the 317 people who are dying. Colorectal cancer mortality rates in New Mexico are way below the national average for screening. Screening rates in New Mexico are right just below 60%, but 1/3 of people in New Mexico report not having been screened ever. So we have a long way to go. Screening is not happening enough in New Mexico. So we certainly want to increase those rates. Another point I think I'd like to point out, talking about colorectal cancer, because it really does affect men as well, is that men in New Mexico are much more likely to develop and die from cancer. So screening is important. And speaking to men about cancer and getting to that doctor every year, and having the conversation about health is really critical to start bringing down the incidence and mortality rates in New Mexico.
Okay, well, let's talk then about the importance of screening, or the benefits, rather. The benefits of screening.
Yeah, absolutely. With colorectal cancer, screening is absolute prevention. We can really find it and stop this cancer. So, as I said, less than 60% of the population is being screened for colorectal cancer. And yet, the benefits are so huge. We can prevent the disease because colorectal cancer starts with something called a polyp. And that is a growth that begins in the colon, which again is part of our intestines. When that little growth starts to grow, it can start to change as it grows, and it can start to become cancer. So if we screen for cancer in the colon or rectum, and we see that it's starting to grow, we can go in and remove it. And most people who have those polyps removed never get cancer. So it is concerning to know there's a polyp there starting to grow and get started. But we can stop it, remove it. It will not turn into cancer. And if you find colorectal cancer early, you have a great chance of beating it. So if you find colorectal cancer stage 1, you have a 92% chance of recovering from it. If you find it stage 4, your chance of recovery is 11%. So again, finding those polyps before they can become cancer stops it, never turns into cancer. Finding those polyps in their earliest stage of growth can also maybe not prevent it, but give someone that 90+% chance of surviving.
Okay, so we have another visual aid also from Health Ed Co that demonstrates what Doreen is talking about. So with this upper left diagram, so this is normal tissue without any polyps, and here is an example of what the polyp might look like in the colon. Again, you know, not all polyps are cancerous, but they do start as polyps. And here's where in stage 0, the polyp has grown to other areas. In this stage 1 and 2, it's actually as part of the lining, and in stages 3 and 4, it goes beyond the colon. And did you want to comment any more about these stages?
I did. The polyps are a bit like a mushroom with that larger head and then that bit of a stem. Not every polyp looks like that, but that's a common polyp. And someone can see how easy it would be for a surgeon to go in and snip that at that stem and remove it. Cancer can still be removed in the colon in these stages, but as you can tell, that removal may start to be a little bit more of an invasive procedure that may cause side effects afterwards. So we really want to find polyps in that stage. And polyps are most likely to be developing as we get older. So again, screening starts at age 50 for colorectal cancer. And that's evidence-based to start at that age. That's when we start to see some of these changes, unless someone has that personal history or a history of colorectal cancer, and then they'd want to start screening earlier, just like with breast cancer.
Okay, so there are several types of cancer screenings. Would you describe the types of colorectal cancer screenings? And you started to touch on the recommendations by the American Cancer Society.
Yes. Recommendations for colorectal cancer screening are more consistent across organizations. We all agree screening should start at age 50. That's when people are getting to be at higher risk. For many, many years, we've promoted colonoscopy as the gold standard for screening. Colonoscopy is a great screening exam because doctors can go into the colon and see those polyps and then remove them. And so it's sort of a one-stop shop for your screening and prevention. But colonoscopy is hard. There's a lot of prep. There's time off of work. There's time to go to the procedure and have someone take you and pick you up and drop you off, and lots of barriers. There are now other testing options that are just as good or maybe as good as colonoscopy if followed according to guidelines. So these tests include, well, first, let me say, colonoscopy is recommended every 10 years. Okay. That's another reason folks like colonoscopy once every 10 years. If a doctor finds something, they may recommend follow-up a little sooner. So it's not always 10 years, but that's the recommendation. There's a test called a flexible sigmoidoscopy, which is similar to a colonoscopy, but the instrument does not go up through the entire colon. Okay. But it's a little less invasive, maybe a little easier for individuals to tolerate. Okay. And that should be done every 5 years. There's a take-home test, and there's been a take-home test for many years, but there was a way of preparing that take-home test and doing it that was not a popular test with individuals to take. So, but there are many benefits to doing a take-home test. It's a stool test. You've got it at home. You decide when to take the test. It's done in the privacy of your home. There's no dietary restrictions, and it's a very easy test to take. So we have an updated test called a FIT test, and that stands for Fecal Immunochemical Test. That test is looking for blood in the stool, because as polyps grow, if they start to bleed, that's when they become cancerous. So this FIT test can tell if those polyps are acting up. And so FIT test, though, because it's a stool test, needs to be done every year. And then if it's an abnormal result, if it detects some polyps, then a doctor would recommend the colonoscopy. But the FIT test is very inexpensive. It's covered. And it's a really great test. There's a little brush. It is a stool sample, so someone will need to prick a stool sample, put the brush, mail the kit. It's really, we're getting a lot of good response to it as an alternative to colonoscopy. Recommendations do say, though, that if someone chooses FIT test as the best test to do for them, it's a little more effective at finding cancer if paired with that flexible sigmoidoscopy every 5 years. So we still want the doctors going in and looking occasionally just to check out that colon. Just two last quick points. The best test is the one that someone can get done. So there are options. Not everyone can do colonoscopy. It's important for everyone to check for colorectal cancer screening. So having that conversation with a doctor about what's going to work best for you is going to be the most effective test. And if there is a family history of colon cancer or certain medical conditions such as Crohn's disease, an individual may need to just have the colonoscopies. That's what their doctor's going to recommend. And that will be the best way to prevent that colon cancer.
Okay, so we've covered really the importance of mammography and colorectal cancer screening. Hopefully we have inspired our viewers to explore the topic a little bit more or get screened if it's time for them to be screened. One last question, and that's where would you direct our viewers if they would like to get more information about these topics?
If viewers have access to online services, they can visit cancer.org on their internet or on their browser. Cancer.org is the American Cancer Society website in conjunction with the National Cancer Information Center. And there is a professional, there's people available to answer the phone every day, all night, even weekends and holidays. The American Cancer Society makes it its business to go out and find every resource and every tool available to fight cancer. And we've got all of those resources in our toolbox. When individuals call, they can be navigated to information, to free services, to local support. Really, that number is a one-stop shop, and you're going to show that number, that phone number, 1-800-227-2345. The phone number and the website work in conjunction with each other. So people can access those resources either online or by phone if there's someone they'd like to talk with.
So we have cancer.org, and then is there a local Cancer Society office number?
Yes, thank you for asking. I am located in the Albuquerque office. Every state has an American Cancer Society office and staff on the ground finding the resources. Our local number is area code 505-262-6010. Anyone can call that number and ask for me, for Doreen. I am happy to navigate people to the resources and information they need. And that we are always available in town to reach out and speak to people and drop off information. And we really try to stay connected at the community level in all of the states where we work. Cancer is different in states, and so we need to be in every state to know what the burden is in that state and then respond appropriately. We hope people will reach out. We do free rides to treatment. We do many free resources, free wigs, and I hope people will call us if they need us.
Well, perfect. Well, thank you so much for sharing the resources and being available and all of the information. I do look forward to talking to you in the future about other health conditions. And so with that, we'll close the program and just want to say thank you for watching the program. And until the next time, be well, my friends.